As government is prioritising the curbing of the spread of COVID-19 by enforcing restrictions, similar efforts to support the mental health of people during this time is not being prioritised. This is according to Psychologist, specialising in EQ development, and the CEO of Mygrow, Mark Baker. Well, in an effort to improve the mental health of citizens during this uncertain time that brought depression and anxiety to South Africans, Baker has come up with a 30-day wellbeing jumpstart challenge. He joins us now via Skype to tell us more about this challenge. Mark, a very good morning to you. Thanks for joining us. Welcome.
Yeah, thanks so much for having me this morning.
Oh, it's a pleasure. Why is mental health so important in a time as uncertain as this one, as we find ourselves in at the moment?
Well, there's two big problems, I think. The one is that it's often the forgotten about part of the experience. Our focus is so much on the financial implications and the health implications that there's a whole lot of support to help people financially and health-wise, being sent out from government, but very little being done to support the psychosocial or the emotional experience of it. And then, of course, the second big problem is that this is the one that is so difficult to measure and account for, and what's been amazing is starting to see some of the research coming out around people's psychological and emotional experience, which is really just a tragedy to see how many people are struggling underneath this pandemic.
Okay, just give us a brief outline of what the 30-day Wellbeing Jumpstart Challenge is and what really inspired it, and what is it that you really seek to achieve?
Well, we got together psychologists from all around South Africa to put together support mechanisms to help people in this time. And the 30-day Wellbeing Jumpstart Challenge is a 30-day journey to help individuals to go day by day the process towards helping themselves to restore emotional well-being. And what it is 30 days of free access to Mygrow, the emotional intelligence platform. That's the daily online gym for emotional health. Then, as part of the 30-day challenge, there are other activities that people can do and will be prompted to do on the platform. It all happens on one's cell phone, by the way. But these are activities prompted that one can do with one's friends, with family, with colleagues, so that each day there are different exercises being done to build and maintain psychological and emotional well-being amidst this very difficult time.
Now, the challenge includes practical, inspiring daily tasks. What are some of these?
Well, an example is, there's an online gratitude game where you click a button, it prompts you with, it's called a gratitude generator, and you would then type into the platform, or with your friends, you would share things that you are particularly grateful for at the moment. Another activity is using your signature strengths. On the platform, you'll see that on a day-by-day basis, you can assess what some of your strengths are, and then use them in a new and different way, just to bolster one's self-esteem in a moment where, times are not really speaking of a very positive view of oneself. There are also podcasts for kids to listen to as they go to bed at night, stories to help them to navigate, this current pandemic. There are conversational points for parents to have around the table with their kids at night, and for partners to just engage relationally. Something that's blown my mind is that the divorce rates are up 20% in South Africa. And so even, marriages and relationships are just needing some prompting to have more healthy interactions in this time. So it really is a whole host of activities, and it's all facilitated by the app that can be found at mygrow.me.
Okay, and just picking up on that, do you think that government should be doing more in relation to the mental health of its citizens during this time?
Yeah, absolutely, yes, Simpiwe. I think it's such a vital thing. We had a conversation, a couple of weeks ago on Morning Live around how employees, if their mental health is not looked after in this time, they might go back to work, but it will carry on with an emotional lockdown or a psychological lockdown for organizations. So I think this is a critical tool. There's a number of organizations, in fact, that are doing it for their staff, sharing it with their staff, the likes of Massmart, Nedbank, Smollen, Uber. There are a number of organizations that are deciding to make this 30-day wellbeing challenge available to their employees to help them in this time so that when employees go back to work, they can actually be effective and contribute again to restoring the economy.
Mark, according to experts, South Africa is currently facing a mental health crisis prior to the lockdown. As a matter of fact, you just came up with a very profound term, an emotional or mental lockdown. And I know that there is a risk that it will worsen if we're not proactive enough in dealing with it. So what are the dangers of not dealing with this head on?
Well, let me just give you some of the statistics, because I think that'll put it in perspective, SADAG, the South African Depression and Anxiety Group, has done quite a bit of research or surveying through this pandemic, as well as the University of Johannesburg with the Human Science and Research Council. And let me just share a couple of the stats here. They're finding that 12% of people are struggling with suicidal thoughts. I mean, what is that going to do to, South Africa? What is that going to do to families? What is that going to do to organizations if suicides are on the rise, which they are? 40% are reporting being clinically depressed, and that's up from in the region of 30%. 30% have suggested that they're struggling with unbearable loneliness in this time, which of course we can understand. You've got grandparents that are not able to interact with newborn grandkids. I mean, that's just a radical issue. A couple of other things is that 55% are reporting struggling with anxiety and panic disorders. And this is up also from in the region of the mid 30%. So that's almost a 20% jump. 60% are struggling with high stress. That's going to put, problems with heart disease through the roof. So people are really in a bad way. And part of what is critical in this time is that resources are made available to help people, because, of course, the time it would take for the government to develop and roll out these kind of resources is going to take way too long. I see on the screen there just 30% reporting broken family relationships and 20% increase in divorce rate. I mean, where this means people are literally level 4 gets opened up for people to get out of their house, and they have run to wherever they need to go to apply for divorces, and there's been a 20% increase in divorce. So people are taking strain. And because at Mygrow we've got all of the technology already developed to help people with their mental health, all we've done is bring together psychologists from around South Africa, build a whole lot of resources, and create it in a 30-day journey to give away to everyone for free. It is for free, by the way. I'm not sure I mentioned that. Okay. And really what it's going to do is just bring restoration to people, almost like a breath of fresh air in this time, restoring people and families from the inside out.
Mark, this lockdown certainly has brought, huge strain in people and in organizations, which has led to job losses, retrenchments, pay cuts, which has thrown so many people into a financial distress. And this is likely, it's also a potential breeding ground for throwing people into a mental meltdown. And some of these victims of this mental meltdown are of the, opinion that money would be the only thing that would heal them. Is it, though? Is it really something that can heal them, or do they need to undergo further mental training, as it were?
Well, let me just say simply, where there's been a lot of research actually done on the psychological impact of financial improvement, specifically surrounding people that have won the lottery. Some psychologists, believe it or not, track the people around the world that have won the lottery. And what they find is that there is about a 3-month period in which the physical changes in one's life can have a positive emotional impact on oneself. So you win the lottery, you've got 3 months of positive emotions, and then you tend to regress back to your typical emotional climate. So if you were somebody that was particularly depressed or anxious or down about life, and your financial situation changed, well, that would help for a period of time, but it's going to be very short. What is vitally important is what these psychologists are finding all around the world is some very simple techniques, like the ones being made available on the 50-day challenge, can build one's positivity, can build one's mood from the inside out, so much so that even if the financial situation in someone's life, the practical situation in someone's life, or the family situation in someone's life is really in a terrible way, it is possible to change oneself from the inside out, regardless of what's happening on the outside. So these are powerful tools that have been tested empirically around the world, and they're just being made available in this 30-day Wellbeing Jumpstart Challenge.
All right, Mark, you really opened our eyes to some issues that we were oblivious of. Thank you so much for sharing your thoughts with us. We appreciate it.
Perfect. All the best.
Thank you, man. That was psychologist specializing in EQ development and CEO of Mygrow, Mark Baker, speaking to us about the 30-day Wellbeing Jumpstart Challenge, which seeks to help South Africans deal with the anxiety and stress brought about by COVID-19. Let's take a quick break.